Okay, my name's Sam. I'm going to be your student nurse today, and this is when I would perform hand hygiene. So do you mind telling me your name and date of birth?
Yes, Taylor Claiborne, 3/10/99.
Okay, perfect. So today I'm just going to be giving you a quick head-to-toe assessment. You shouldn't feel uncomfortable or any pain in any way. If you do, you can just stop me, and I will love to answer any questions you have. So I'm just going to start by asking you a couple questions. So you do know your name. Do you know what time of day it is?
Nighttime.
Do you know what I'm doing?
A head-to-toe assessment.
Okay, and do you know where you are?
Jacksonville, Alabama.
Okay, so my patient is alert and oriented ×4. Follows commands pretty easily. Now I'm just going to check your eyes if that's okay. So my patient's eyes are equal and around, and if you can stare at my nose. Okay. And if you can follow my finger. Okay, and if you can follow this pen light. Good. So my patient's eyes are equal, round, reactive to light, and they're probably about a 6. I have heard you talk, so your speech is clear and intact. And I'm just going to see how you respond to any stimuli or anything. So can you squeeze my fingers? Can you feel this?
Yes.
And did this pinch hurt?
Yes.
Okay. And now I'm just going to check that respiratory rate. So if you can just be right here. It's going to be 1 minute. Alright, my patient's respiration rate was 15. And now I'm just going to listen to all the breath sounds and all of those lung fields. That's okay. So I'm just going to ask if you could take a deep breath. Again. 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 I'm going to get under that shirt if that's okay. Deep breath. Deep breath. Another. Again. 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 Good. If you can turn to the back and I can listen back here. Alright, take a deep breath for me. Another. And we get under that shirt if that's okay. Okay, deep breath. Another. 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 Another one. Another one. Another. Last one. Good. So patient's breath sounds sounded very clear. No signs of any crackling, wheezes, wrong kind, none of that. Patient did not use any accessory muscles, no signs of any nasal flaring, any coughs or anything like that. So now I'm just going to take your blood pressure if that's okay. So I can use this arm. Okay. Okay, so I got 118 over 82 for blood pressure. Now I'm going to check that apical pulse, so if you can lay down for me. Okay. So this is going to be on the left navicular side, 5th intercostal space. So can you lift up your brow? Okay, good. You can lift it down. Alright, my patient's apical pulse was 75, so that's good. Now I'm just going to check that capillary refill, so I can see your fingers. And, okay, came back in less than 3 seconds, so that's good. I'm going to check your peripheral pulses. So, check that temporal pulse. Okay, I'll give both of those a 2+. Check your carotid. Oh yeah, 2+. 2+. Check this radial pulse. 2+. 2+. Check your brachial. 2+. Those are strong. Oh, sounds good. Now I'm going to check your femoral pulse if that's okay. Give that probably about a 1+. Ooh, that was a 2+. I'm just gonna check your popliteal pulse, so it'll be under here. Maybe that one probably about a 1+. No 1+. I'm gonna take your socks off if that's okay, so I can check your pulses. So check your dorsalis pedis. 2+. Check that one on this side. 2+. Check the posterior tibial. 2+. And 2+. That's good. Checked all those peripheral pulses. Now I'm just going to listen for vowel sounds in all 4 quadrants and do a quick abdominal assessment. So if you can lay on your back again for me. Okay, I'm going to start in the right lower quadrant up to the right upper, over to the left upper, and finish at the left lower. Pulse down.
Yeah.
Okay. Oh, good. Good. Ooh. Bowel sounds present in all 4 quadrants. I heard those really, really good. And have you been experiencing any pain, any tenderness, anything in your stomach in any kind?
No.
Okay. Alright, and if at any point this hurts or anything, just let me know. Okay, perfect. And you can sit up for me. There's no signs of any catheters or anything. And the last time you urinated, can you describe to me what color, odor, and any of that?
It was clear and odorless.
Okay, perfect. And do you remember when your last bowel movement was and the color and odor of that as well?
This morning, brown and odorless.
Okay, do you experience any discharge or anything?
No.
Okay, my patient does not wear any diapers or anything, and I know that she is on a regular diet and did report to me that she tolerates her food really well, and for breakfast, lunch, and dinner today she ate 100%, so that's good. Now I'm just going to check your upper and lower extremities if that's okay. So They look really good. No signs of any rashes, lesions, any of that. I'm just going to lift these up. Alright, good. Okay, so can you squeeze my fingers? Press against my arms. And then can you press against my hands? Good. So upper and lower extremities are both equal and strong. Now I'm just going to assess any edema. So I don't see any edema present in any of the upper and lower extremities or any of that. No discoloration of any kind. Skin looks pink, warm to touch. Looks good. So do the legs, pink, warm to touch. No signs of any lesions or rashes or any of that. And I'm just going to check for skin turgor. Okay. No signs of any tinting or any of that. All of her skin does look intact. And there are no signs of any dressing, wounds, rashes, red areas, none of that. And the final question I'm going to ask is, if you are experiencing any pain right now, on a scale from 1 to 10, what would you rate that pain?
I'm not in 0.
Okay, good. So then I would document all my findings as my patient and how well she tolerated everything.